Good morning, everyone, and welcome to our first live future conversation for today. You could tell it's live because I'm now wearing something different than when I just spoke to Ashish Shah from Dina and introducing our future leaders. This isn't the Oscars. I didn't change here, just our first live event for today, or live panel. There has been so much going on in healthcare, new technology developments, with the use of telehealth increasing anywhere from 400% to 8,000%, depending on what statistics you look at. COVID is obviously still front and center. And shifting care into the home isn't just an innovative concept anymore. It's really becoming a necessity. But for home health and home care providers to really take center stage during this conversation, we're going to have to elevate the discourse. We're going to have to elevate the conversation itself and think more critically about the business of home-based care. To help us do that, I am pleased to welcome John Olajide to the virtual stage. John, of course, is the founder and CEO of Axxess. John, thanks for being here.
Thank you, Bob. Glad to be here.
All right. And a quick, thanks to Axxess for supporting this event in the first place, too. Before we jump into things, how are you doing? How are you and your team at Axxess doing?
I'm doing wonderful, Bob. Thanks for asking. Our lives are no different from everyone else's life. It's an interesting year for everyone. I'm in the office today, but we've been operating virtually since March. So all our people across the world are working from home, and well, they're fine. We're checking on them constantly, and things are good, and we're making sure we support them as they support our clients. So I'm happy to report that things are great at Axxess. I'm fine. My family is good too, and I hope things are great in your world, Bob, as well.
I appreciate it. John and I were just joking before getting started that we both have horrible allergies. So that's one of the problems we're dealing with right now. Yep. We have a lot of ground to cover in talking about healthcare and elevating the conversation, but Axxess and HHCN did just release a survey that really provides a snapshot of how home health providers are doing in regard to COVID and the transition to PDGM. Let's maybe start with that point. Axxess obviously has access to great data. What are you seeing and hearing in regard to PDGM and the transition?
Great question, Bob. You mentioned PDGM, you mentioned COVID. Going into 2020, the entire industry was focused on PDGM, and then, of course, COVID hit all of us in the face. While we're dealing with that, we still have to deal with PDGM as a regulatory requirement to keep our businesses going. So, Axxess was early in preparing organizations and helping the entire industry get ready for PDGM. The way we see it, we are a partner to the industry, and particularly our client partners. You hear me say this a lot. We take this responsibility very, very seriously. So let me take a step back and just walk you through PDGM, and then we'll talk specifically about how our folks are doing and what we're seeing based on the data. Our approach really was to make sure we educate the entire industry and our client partners and make sure they understand. This was early last year, help them understand what PDGM was. And we did lots of training sessions all over the country, in person, virtually and all that. And our goal really, beyond just educating, was to really align the entire industry around what needed to be done to ensure PDGM success. And then once we understand that, we get to the execution phase, making sure our technology solutions can help our clients succeed and making sure they're truly empowered with everything that they need to be successful. And then let's report on that. And that's why we're having this conversation. We're very invested in our client success. As they do, so do we. We want to make sure they're very successful. And we continue to provide education to the industry as we all adapt to PDGM. So what the data is showing us is that organizations have really adapted well to PDGM. Naturally, the organizations that were most prepared have done better than others. In fact, there are several organizations that are seeing increased reimbursements, for the work that they're doing. Naturally, COVID has presented some challenges, but as a survey you mentioned earlier shows, some agencies are doing really well. Like I mentioned, the ones that are very well prepared and have all the tools and resources they need and have the right partners to help them drive their growth. But from the survey that we saw, staffing continues to be a challenge even in a COVID and PDGM world. But overall, clients that are organizations that are well prepared are doing well. And you know, there are lots of conversations around doom and gloom for PDGM. We had a counter position, as I shared with you last year, that we saw opportunities. We saw PDGM as a good thing to make sure we can standardize care and do the right things for patients. And we saw that as a move toward patient-centered care. So as we're looking at the data, it's making it obvious that if you have the right tools, you're well prepared, and you're positioned for success into the future, PDGM is a good thing.
Yeah, I certainly remember the conversation that we had when we were doing a lot of reporting on the doom and gloom, that perspective, and how some felt PDGM would automatically trigger this wave of consolidation. Axxess has really been bullish about PDGM being a good thing, especially for quality of care and a more holistic approach. All right, well, let's shift gears a little bit, because our survey did touch on some of the biggest challenges providers are currently facing. And I want to go through some of those, digging a little bit deeper into staffing. So here's a stat for all those tuning in. More than 31% of our survey respondents said that staffing-related challenges during COVID were a key reason for revenue being down. Not necessarily the declined visits, but rather staffing challenges. Another stat, nearly 75% of our survey respondents said that staffing was a key barrier to business growth in 2020. John, why does staffing remain such a pain point? Because it feels like we're having the same conversation year after year after year.
You know, Bob, I really appreciate the way you frame that question. Your question is, why does staffing remain such a pain point, and what can be done about it? You know, we see this totally different than the rest of the industry sees this, and we've been talking about this for a long time. We don't just see this as a staffing problem, you know, and I'm glad that the conversation we're having today is really to elevate our thinking around how the best care in the home can be delivered. At Axxess, we see this as a marketplace problem. Some have staff, some don't. We have data, we have thousands, tens of thousands of caregivers on our platform. We have patients that need to be seen, so we can see what's happening here. We recognize very clearly that this is a marketplace optimization problem. Mm-hmm. How can you get the right people with the right skills at the right time to see patients? So we're having the same conversation over and over and over again because we're not thinking about this the right way. And if we keep thinking about this simply as staffing, look, about 20 years from now, we'll be having the same conversation. So the industry is working from a model that doesn't work. So let me give you an example. When you think about the transportation industry, for instance, imagine the yellow cab company or a cab company saying, you know, we're having struggles because there's a decreased demand for on-demand transportation. Mm-hmm. You might know that's not true. Uber is growing, Lyft is growing. People want a different type of service. They want to differentiate it. They want something different. So that old model of hailing a taxi does not work anymore. So it has to be a different model. You know, another example is just your business, the journalism business. You know, there's an increased demand for content. Imagine a newspaper company saying, well, we're having struggles because we cannot sell enough newspapers. Clearly the demand is growing. People want more content, but you're just delivering it the wrong way. So the way we see this is totally different. It's a marketplace problem. There's an optimization problem that needs to happen. We have the technology platform to make things work. So as we investigated this problem, we thought we're a partner to our clients, we're a partner to the industry. Let's create a different solution. And that's why we created Axxess Care. I've talked to you about this before. Axxess Care is a revolutionary staffing and scheduling solution to really help organizations get the right people at the right time with the right skills to see the right patients in a way that's a lot more efficient. As a staffing solution, well, let's start with as a scheduling solution. If you're an organization and you want to schedule patients, instead of having your scheduler get on the phone and call different people, the software can do the work. We have artificial intelligence tools, automation tools to make sure internally in your organization, you can have the right person on the right skills that's closest to that patient, that has the skills needed to see that patient. So that's an internal solution. If you want to grow your business and extend this as a staffing solution, you can as well. You can find qualified professionals in our network, the Axxess network of caregivers, the right skills, they've been vetted, they have the right skills, they have the right training in the right places to see the patient. So we need to think about this totally differently. Otherwise, we'll be having the same conversation 20 years from now. So this is a win-win. It's a win for organizations. They have more control over how the care is delivered, yet more flexibility at the same time. And for the clinicians, it's a win as well. You know, more control, more flexibility. So as an industry, we cannot keep doing things the same way we've always done it and want different outcomes. I've read someplace that that's the definition of insanity. We've got to think about this differently. And if we want to make sure the home is that center of excellence that we all know it to be, it can be, and we want to create incentives for the best and the brightest to get into our industry and care for patients, we've got to think about staffing totally differently. We have a solution that works. We have organizations that are using it and they just absolutely love it. Recently, we shared some data that, you know, we started a pilot program in Texas and we're rolling this out nationwide now. It's in 20 states. And we shared a data point that we had reached an important milestone, 20,000 visits completed. So the growth is staggering now. So what took 2 to 3 years to accomplish from a growth perspective, Bob, we're accomplishing that a lot faster. I'm happy to share with you now the number is 30,000 plus visits that have been completed on this platform, and it's continuing to grow. So we need to think about this differently. We need to figure out how we can leverage technology to bring the right people in and really tackle this issue and do something totally different from what we've ever done before. And that's really elevated thinking.
It's funny that you brought up the publishing and journalism industry as a comparison to what home-based care providers are going through, because I see similarities all the time. One of the reasons why we're successful here at Aging Media Network is because we go deep on very specific topics. And I see home health and home care providers doing the same thing as well, going deep in very specialized lines of care. So just a quick aside there. I want to stay on the topic of staffing because there was something else our survey touched on and something that's very relevant to the current national discourse. Many of the clinicians and caregivers actually going into the home to deliver care to patients are people of color. And as the 2020 chair of the Dallas Regional Chamber of Commerce, you've been very much engaged in the national conversation around diversity, equity, and inclusion in recent months. How does diversity, equity, and inclusion play into staffing challenges?
Wow, what a question, Bob. Interesting question.
And keep in mind, we only have 30 minutes for this panel.
Got it. I'll keep it real quick for you. I think, first of all, it's good to give people context what the Dallas Regional Chamber is. It's the leading business organization in the Dallas region. And the mission of that organization is to make the Dallas region the best place to live, work, and do business. So that's that. So as I get into why this is important, I just want to share a quick analogy for you. Bob, imagine 10 people in a boat trying to get somewhere, and you only have 3 of them row with, okay? They're rowing with the 10 people in the boat. They're working extremely hard to move that boat along. But just imagine if all 10 were empowered to row along with them. Now they can go faster, they can go farther, and the strain is reduced on all of them overall. Yeah. So that's a benefit for all of them. So that's how I think about diversity, equity, and inclusion at a very high level. How can you make sure you can bring all the people and get them involved and make things work? In our industry, a lot of the caregivers don't live in communities where they provide care. They have to commute long distances to see their patients. So what can we do to make the jobs more attractive? You know, they're driving long distances to get there. They're not close to it. So even in our industry, as we're thinking about driving growth for our industry, we need to drive economic and professional success for all members in our industry. You mentioned that a lot of the caregivers are people of color. So how can we make sure that those that have a heart for care in the home, that are in the industry as home health aides or coming up the entry levels, how can we empower them to rise in the industry, empower them to get into leadership positions? So as I think about this in 4 buckets. How can we ensure diversity in leadership, make sure there's career mobility for all? How do we make sure we keep training the workforce in our industry, educating them to make sure our industry is more attractive for career growth for everyone that's in our industry? And you know, we in the home health care industry, in the care at home industry, home health, hospice, home care, we're in the community. How can we make sure the work that we're doing makes a difference from addressing disparities perspectives? from a addressing social determinants of health perspective. And it gets me to my fourth point that I want to talk about, business being a force for good. I talk about that all the time. How can provider organizations and the industry as a whole do all we can to make sure we're truly making a difference? You know, last year, the Business Roundtable made a comment that beyond making a profit, businesses serve a critical social function to make sure their communities are made whole, and they're adding value. And those organizations can really leverage what they bring to the table to make sure all stakeholders are doing better. You know, why should a business be in a community and just devastate that community and think that's good business? How can we bring everyone along? How can we make sure that we have staff that can meet people where they are? So I think that the challenge really is bringing along everyone, making sure there's career mobility for them, making sure we have diversity in leadership, or making all the right investments. It's good business to do this. You know, it's the right thing to do. And the key really is to help everyone feel empowered as we all do this work together.
I joked about, you know, this panel only being 30 minutes because it seems almost unfair to ask you such a deep diving question. But thank you for weighing in on that. Just very briefly, for those tuning in who don't know the difference between diversity, equity, and inclusion, could you very, very briefly kind of touch on those terms and the key differences between them?
Excellent. You know, I think I like that question, Bob, and I want to put a frame around and put that in context for everyone that's listening. I believe that a leader's single most important job is to make sure that people feel safe at work and they can bring their whole selves to work. I think that's very important, whatever that is, whatever attributes they have. So, you know, recently, one of my friends, she's the CEO of the Dallas Mavericks, the basketball team, St. Marshall. I like the way she described diversity and inclusion. What she said was, diversity is like being invited to a dance, and inclusion is being asked to dance. And I like that. I think that really simplifies it for all of us. And the way I think about it, equity is having a voice, having a two-way conversation, having a may the best idea win mentality. You don't want to just talk to people or talk at people without them being engaged in that conversation. And there are lots of benefits to this. I read a recent McKinsey study that showed that organizations in the top quartile from a gender perspective, from a gender diversity perspective, were 21% more likely to show more than average profitability. And then additionally, organizations in the top quartile in ethnic diversity were 33% more likely to show more than average profitability. So diversity, equity, and inclusion, as we're describing it, makes sense, and it's good business. And at Axxess, our success really can be attributed to the fact that we have folks from all over different industry segments all over the world. So we get a range of ideas, people with different experiences that can help us grow. And as an industry, we also need to create frameworks and institutionalize initiatives to promote diversity, equity, and inclusion. And that's how I think about it.
Yeah. We recently ran a Q&A with Encompass Health CEO Mark Tarr, who echoed all of those points and made the point that diversity is directly tied to your bottom line.
You know, Bob, I just want to say something real quickly. I just want to commend in our industry what the National Association for Home Care has done recently with their new diversity, equity, and inclusion initiative. It's very commendable. I like that. I think that's solid, and I am proud that as an industry we're headed in the right direction.
Going back to the Axxess HHGN survey and staying on this topic, nearly 80% of respondents said that they have already increased resources for diversity, inclusion, and equity initiatives in 2020. Also in the survey, there were more respondents who said addressing racial equity would have a bigger impact on their business than changing payment models. Wow. That surprised me. Did that surprise you?
Wow. I said, wow. Wow. It just surprises me that people admit that, So just given that, I am very, very proud of all the leaders who responded in that survey. And I'm not surprised that diversity, equity, and inclusion is an important issue. It should be. The problems have always existed, and many of us just never quite thought about it that way. But to put this in context, I was having a conversation with a leader of one of the national global consulting firms recently. She said something that I think is profound. She said, John, I believe that diversity, equity, and inclusion is the single most important issue in business today. I think that's powerful. And as I said earlier, our industry cannot continue investing in talent and then not offer them opportunities to grow. What happens is that we end up losing that talent to other industries after having invested so much. So as leaders, we have a greater responsibility for making our communities and certainly our industry more just, more equitable, and because we're the ones with the influence. So we need to do all that we can to empower everyone in our organizations to perform at the highest level possible and support their growth. It's good business to do so. So I'm excited that from the survey, um, our industry is thinking about this, and I'm encouraging everyone else that's willing to really step up and help with this, and it helps us get to the idea even of health disparities. There's a lot of literature already that really documents health disparities the past few decades, in our industry. So I'm glad leaders are stepping up. Everyone needs equity in access to healthcare, and given what we know now since COVID about how healthcare challenges in far-flung places can impact all of us, it makes sense to make sure we're carrying everyone along. So I'm really proud of our leaders for just stepping up and admitting that openly. That's solid.
John, I know you're somebody who really likes to skate where the puck is going. Let's talk about the future of healthcare. I know you really believe the future of healthcare is in the home. Could you talk about your vision, what it looks like, and how that vision is driving your work at Axxess?
Thank you, Bob, for that question. And we believe in this so much that it's right there on our website. The future of healthcare is in the home. That's how we think about our business. That's what we're solving for. So let's take a step back and just think about in the long arc of history. The truth is, care in the hospital as we know it is actually a more recent phenomenon. That's the truth. Technology has always driven the evolution of healthcare in more ways than people recognize, Bob. So when healthcare started, as we understand, you have patients in their homes and there are caregivers, doctors, nurses that want to go see patients in their homes. As the technology to deliver healthcare evolved, there was a need, and then you had huge diagnostic equipment and things like that. So there were centers where all the equipment was. There was a need to place patients close to the equipment. That's how hospitals got created and all these other healthcare settings. So healthcare started in the home, and today it's coming full circle. Your phone is a more powerful healthcare device today than all the huge equipment in hospitals way back. So it's important that people recognize that, that technology has always driven healthcare. It will continue to drive healthcare. And really, healthcare is about technology. So you cannot deliver healthcare in isolation and say, well, I want to deliver healthcare and have technology be an afterthought. It doesn't work. Technology always drives it. So let's bring this conversation to now what we're dealing with as we think about COVID. I cannot put a time frame on when we'll get back to a world where COVID is not the central driver of healthcare or of everything. But one thing I'm sure of is this. COVID has totally rewritten the future of healthcare delivery. And again, that future is going to be in the home globally. We've learned a lot from COVID, and the silver lining is the recognition of the many advantages that care in the home brings. In the past, you'll explain care in the home to people and they didn't quite understand it. But now everyone gets it. With COVID, everyone's cooped up at home. So we need to build upon all these advantages, leveraging technology, telehealth, to deliver safe, efficient, and cost-effective care. And there are lots of opportunities in our industry to do that. And we need to keep growing relationships to educate everyone so everyone gets that.
Yep. Well, Axxess itself is a technology provider. And I know that you've been excited to see the use of telehealth advancing so quickly in recent months as we continue to deal with COVID. As I think it was Seema Verma and so many others have said, that toothpaste isn't going back in the tube. Beyond telehealth, you're a big believer that care at home organizations will benefit tremendously in using technology to manage compliance and to create efficiencies to remain viable in this ever-changing regulatory environment that we live in today. Can you talk a little bit more about that?
Bob, at the risk of sounding self-serving, really, the way I say this, the choice of a technology partner is the single most important decision any healthcare organization will make. With the right technology, you can find the right people, you know, and empower them with technology to grow your business, improve patient outcomes, ensure compliance, you know, streamline operations, decrease costs. But just on the compliance side of it, just think about it this way: organizations can be fully virtual now. A clinician can complete an OASIS assessment on her smartphone, ensure it's fully compliant and reviewed, move it over to billing, and then the agency can get paid more, get paid faster than ever before. Clinical teams can collaborate and build a patient plan of care virtually from anywhere and be more productive so they can spend more time on patient care and our paperwork. So leveraging technology with the right solutions partner can help really drive productivity in ways that are just unimaginable. Just think about efficiency from that perspective. And for our platform, we have one single sign-on, fully integrated platform for our client partners to manage all their work. So our clients have total control over all areas of their business in real time, and they can get actionable insights to help grow their business. We've talked about staffing and all the efficiency that we can bring. Another very important piece of this puzzle is helping manage physicians' relationships. It's important that we make it easy for physicians to partner with home care organizations to help them be more successful. So as a technology solution partner, we're addressing physicians' concerns through automation for the hospice side, providing document portals, totally integrated physicians' portals, automating IDG for hospice organizations. So we're really revolutionizing that relationship and making sure it's easier. So, and the way that we do this is we have clinical, financial, and operational experts who work alongside the best and the brightest engineers in the world to help get technology to make our clients more successful. We truly want our clients to focus simply on patient care and nothing else. Let's take care of the rest of it. And this approach has really worked for us. Just having domain experts with engineering teams has led to extraordinary results for us. We have folks from all over the world, all kinds of expertise working together and bringing the best of the best technology to help our clients be successful.
And I mean, on top of better managing staffing, better managing relationships with physicians, technology also plays a key role in claims and payment processing, which is crucial right now with PDGM and all the cash flow challenges agencies are facing.
Yep.
All right, well, keeping along with the theme of our conference, future, let's look ahead. What's the single most important thing you think the industry needs to be focused on right now to ensure that the future of healthcare is and will remain in the home?
Excellent question. It's one that I'm asked a lot. It's one that I think about a lot. And as I said earlier, healthcare does not happen in isolation. Technology drives healthcare. Just yesterday, Apple released new iWatches to help measure your blood oxygen saturation level. That's interesting, So, that's technology driving how we behave. It changes a lot of things. So it may sound self-serving or at the risk of sounding self-serving, but having the right technology is the single most important thing to do. And at Axxess, we're not just providing software. Again, we believe the future of healthcare is in the home, and that's ingrained into the philosophy of how we operate. All of healthcare is technology, Bob. That's how I see that. Technology is going to keep driving change. And home-based care is the preference for over 90% of people surveyed that we've kept talking to about where they want to get care and how they want to get it. So Axxess is addressing that need and making sure we empower providers to deliver care at home in that setting. So technology is really revolutionizing the delivery of home-based care. Today, all documentation can be done on a smartphone in a cloud-based environment 24/7. Just resulting in extraordinary agency efficiency and patient satisfaction. Better patient outcomes, very, very important. So we should, as an industry, we should allow technology to make our lives easier, make it easier. Investing in the right technology partner that will really help be by your side and grow with you is the best thing you can do. It's the best that you can take now as home-based care continues to grow into the future.
Yeah. All right, well, that's about all the time we have for this conversation. John, it's always a pleasure talking with you. Thank you for joining us at Future and sharing your thoughts on the future of home health, but also just healthcare in general.
Thank you, Bob. It's been a pleasure to be here. Thanks for the opportunity.
All you attendees out there, we will see you next at 10:40 to hear from Corridor's Chief Revenue Officer. And then I'll catch you again at 11 for my fireside chat with Bright Springs' John Rousseau. Thanks for attending.